Hi, everyone. I'm your host, Nataisi Mukwavi.
And I am Abigail.
Welcome back to another episode of Girl, You Know It. It's a podcast where we have real, raw, and necessary conversations about the things that matter most to Black women.
Today, we're diving into a topic that doesn't get enough attention: uterine health and how it affects Black women. We know that fibroids, PCOS, endometriosis, and other conditions disproportionately impact Black women. Yet many of us struggle to get the right care and are dismissed by doctors or don't have access to the right information.
That's why we're so excited to have Dr. Ruthe here with us today in her final year of obstetrics and gynecology resident of physician.
That's hard sometimes. That's hard.
I'm not a doctor. I do not want to ruin this. Can you tell me, how do you say this
How do you
word?
pronounce that again?
It's obstetrics and gynecology, but you can just say like obs-gyn, OBGYN.
Obs-gyn. Okay.
Yeah.
And so she will be here discussing all these topics with us. She specializes in infertility, reproductive endocrinology at the University of Toronto. She's also passionate about improving our reproductive health and advocating for better outcomes for Black women. Today, she's here to help us break it all down, why these conditions affect us at higher rates, and how we can better advocate for ourselves and what steps we can take to make better uterine health. So thank you so much for joining us.
We're really excited to
are
have you.
excited to have you.
Thanks for having
That's why
me.
we're starting everywhere.
Yeah. She's also going to help us with these names and these titles because clearly we can't pronounce them. So
What a mess.
You're funny.
So thank you so much for joining us. Can you start about sharing a little bit about your journey and what made you get into this profession?
Yeah, so it started for me in undergrad. So I actually did a pharmacy degree for undergrad back when it was a bachelor's degree. And I, in my final year, did a rotation looking at drug and infectious and other exposures in pregnancy and breastfeeding and how that affected, not only maternal health, but also child health. So when I got into medical school, I thought I'd be really interested in something related to maternal child health. I also am Ethiopian, and I was really interested in like giving back on a global scale. And so I felt like that just fit really perfectly. I got to medical school. I very quickly ruled out pediatrics. It was not for me. I love kids, but
Not to that level.
didn't want to be their doctor. And found that I really loved obstetrics and gynecology. I loved delivering babies. I loved the medicine. I loved the surgery aspect of it. And so that really fit well. I got into residency, and I'm here at the University of British Columbia. And I quickly found that the way that obs-gyn is practiced in Canada, it really just wasn't going to be sustainable for me, for the life that I saw myself leading. And so I found that I was really interested in reproductive endocrinology and infertility, and that helping people grow and complete their families was actually just as exhilarating for me as delivering a baby on the labor floor. I also just loved still working in that team environment and being able to help people, achieve their goals in that way. And so I found that was like a great aspect of care. I also am really into research. So it's a really research heavy field. And so I matched to that, and I'm moving to Toronto actually very soon to pursue that. So
I miss you.
But
we're so happy for you.
Yes.
Thanks.
Yeah, that's awesome. We often hear that Black women are most likely to experience conditions like fibroids and endometriosis. From a medical perspective, can you break down why that might be the case?
Yeah. So for sure, fibroids we know is about 2 to 3 times more likely in Black women as compared to white women. And this data is all out of the United States. As you know, we don't have race-based data here in Canada. So we believe that stat is probably the same, but we actually don't know. There were some thoughts previously, although these have been debunked, that things like endometriosis were less common in Black women, but that's absolutely not true. It related to the fact that Black women weren't seeking care for really painful periods or
just roughing through it.
Totally. And just systemically maybe didn't have access to the same primary care that white women had to be able to get those diagnoses, for example. And we do know about things like cervical cancer and endometrial cancer. We know that outcomes are worse for Black women. So for cervical cancer, we know that Black women are diagnosed later, so tend to have more aggressive disease. And for endometrial cancer, tend to have like higher rates of mortality. So certainly it's, not just about the gynecologic conditions that are not cancer, it relates to the cancer conditions as well.
Wow.
So how do you feel that these conditions typically present themselves in Black women? Is there anything maybe unique that we kind of carry? Is it hereditary? Is it genetics? Is it, or, is it the foods we eat? Yeah, because it just seems like a common thing. I know fibroids is really big on my side of the family as well.
Same.
And so is it something that maybe more Africans carry? Is it a Black American thing? Or is it just Black women in general?
Yeah, so that's a great question. I think you have to look at a couple of things. So the first one is like, what type of environmental and social exposures are we exposing ourselves to as Black women that may potentially increase the risk of some of these conditions? Toxic stress being a big one, and like living in the society being a Black woman is a big one. But also for certain uterine conditions, like specifically uterine cancer, we know that it has been linked to some of the hair relaxers that people have used for, generations that we started when we were really young, and so that is one of the exposures that we know of. And I'm sure there's a whole host of other ones that we unknowingly have been exposed to as a result of the communities that we live in, as a result of like white normative beauty standards that we've tried to hold ourselves to, unfortunately. And then we know as well, like, just being able to access healthcare, like getting those delayed diagnoses, not being treated seriously when we have pain, for example, and then, us ourselves sometimes dismissing our symptoms and being like, no, it's fine. Like I can deal with this.
Yes.
Yeah. And so I think there's a whole host of things that go into it. We don't understand everything, but that's some of them.
We also hear that Black women's pain is often, like you were saying, dismissed in the healthcare system. Why do you think that happens, and how does it really impact our diagnoses and treatment for conditions like PCOS or endometriosis?
Totally. Yeah. So endometriosis being like the hallmark of it is pelvic pain, right? Yes. And so I think if there is a healthcare system of physicians, nurses, like everyone in the healthcare system has been conditioned in this systemically racist system, well, it shouldn't be a surprise that the outcome is that less Black women are believed in this system. Yeah. I think we should also really question a lot of the time that like race is listed as a risk factor for different conditions, when in fact it's like racism is actually the real thing here. It's not a biological difference that our bodies have compared to other people's bodies. It's the fact that we have been exposed to different things as a result of the communities that we live in. We may not be believed to the same extent as other people. And we, again, might not have the same access to primary care as some other folks of different races may have. And so, yeah, I think those are a couple of those reasons.
And why do you feel that? Because a lot of Black women, as we know, have shared when they go into these spaces, the healthcare providers, they don't feel heard by their doctors. They feel dismissed. Do you feel that they're struggling to find doctors that believe them? Or what do you think that conversation looks like for some Black women, or if you've experienced that yourself?
Yeah, I think it's really hard because I've been in the medical field for a long time. And so I know the background, I know the background, I know the terms to use in order to have my concerns heard. And I can feel for people who don't have that background, who don't have that ability to say the words that will, garner the most attention, for example, from a physician who oftentimes themselves is overworked, who has very limited time to take care of people
and has been told you can only see this many patients in a day.
Exactly. And so I think it's like just kind of tough all around. I think, there are certain things that we can do to advocate for ourselves, but certainly there needs to be a big change from medicine from the get-go, from training physicians from the beginning, to say we need interventions that will help physicians in training and physicians who are already out in the workforce understand that actually there are very little biological differences between the races. Actually, the difference in outcomes has to relate to racism in our healthcare system and not actually related to race. And that you might start, in a healthcare field, you might get into medical school and hold some of these beliefs, but you surely should not finish medical school and still believe that Black women experience less pain or that our skin is somehow thicker than other races. Like that is
you can never get an IV.
Like that is just not true. And so those types of beliefs that happen to be held as a result of the system of oppression that we're in really need to be rooted out early. And if they haven't been rooted out and people are already in practice, like that needs to be rooted out.
Right. No, exactly.
What advice do you have for women who are struggling to really get their doctors to listen to them? Would you say, do you have any advice? Or I know you talked about advocating for yourself and stuff like that, but like sometimes it's like you get into a position and this is a doctor, they should know, they know all the things. And so sometimes it's hard to advocate for yourself. I've experienced that multiple times, even currently just right now, but saying things like, can I have a doctor of color or a specialist of color? But back to my question, what advice do you have for women who are struggling to really be heard?
Yeah. So I would say, like, trust your symptoms. Keep a diary of things. People can't, people have to believe when you bring them a diary showing that you've had these symptoms. That you've tracked them for a long period of time. Are the symptoms associated, if it's pain, is it associated with anything? The more detail that you have about these things and the more succinct you can be in communicating these, I would believe the more serious that someone would have to at least take you.
Okay, that's a good idea. I never really thought about that. Tracking it.
I think as well, like, ask for a second opinion.
Third opinion.
Ask for a third opinion. Right?
Sure.
And if you don't feel comfortable asking that physician to say, like, can I have a second opinion from one of your colleagues? Like, go back to the doctor who sent you there in the first place and say, I didn't have a great experience. I understand that they're a physician, they're well trained, but I would really benefit from a second opinion to hear what another doctor has to say about my care. Bring someone with you to an appointment, right? And then if you, again, like, understanding the limitation here of, like, not being able to just ask for a test and get it, but say, I've heard about this test. Like, do you think that would be helpful for me? Or I've heard about this treatment. Do you think that would be helpful for me? Like, and just say upright, like, I'm not a physician, but I had a friend who had this condition or this, what have you, and they had this test or this treatment and they found that very helpful. Can you tell me why that might not be helpful? Might be helpful or might not be helpful for me? And then the other big piece is, like, find strength in your community. So, like, fibroids, again, 2 to 3 times more likely in our community. You have enough friends in the Black community, eventually you will find someone who has that condition as well. Or find someone in your family, for example. Like, I have fibroids in my family as well. So I think there's a number of different things that the person themselves could do. I think there are a number of different things that medicine can do as well. And that's something that I've always advocated for, like diversifying our workforce to better reflect the population that we are taking care of. So for us in British Columbia, as our group, the Black Physicians of BC, we were instrumental in advocating for we not only advocated for, but we also consulted on, and now it's been rolled out, the Black application stream for medical school.
Oh, that's awesome.
Yeah. And so it's been very successful and it's still ongoing. And it's
great.
Really about, like, leaving no talent left on the table and ensuring that Black folks have equal opportunity to access medical school, for example, who have the exact same grades, who have the same amazing credentials and experiences, but are then going to go back to our communities and, those systemic, biases will already be reduced because we have that lived experience. We have seen family members go through what you guys are talking about, or maybe we've gone through it ourselves. So
I had a friend recently, she's pregnant and she had fibroids as well. And so she went to a hospital in Vancouver and she, I'm not sure what the term is, but I guess her fibroids were, is it evaporating or something was
degenerating.
Yes, degenerating. Yeah. And the doctor was telling her all these things. She's about 5 months along, all these things that she should do. And they just weren't listening to her at all. And she said right away, like another Black woman came in and said, actually, this is what's going to happen. We're going to do this, this, and this, and just immediately changed the whole environment for her. But had she not had that experience, it would have been a different outcome. And so even now, like just even hearing her story, I'm like, it changes everything, it can change a person's life. It can change the outcome of how their maternal health is going to be, right? Based on someone's experience and knowing what she needs to experience. And so that also just like brought a little bit more perspective. And so hearing that, it's exciting because those are the moments, right, that can change the whole person's journey of motherhood as well.
Totally. And I know we're talking about maternal health here, but there is a ton of data in relation to like early pediatric care when there is race concordance between the physician who's treating that family and the child. For example, if both are Black, the child is more likely to have a better outcome. Wow. We know that, Black children in the United States, again, because we don't have this data in Canada, it probably is similar here, but are multiple times more likely to die before their first birthday compared to their white peers. And we know that having a Black doctor decreases that odds substantially. And so, that's true for like that limited study. There was a limited study looking at cardiovascular outcomes in Black men. And if they had Black primary care providers, they were far more likely to engage in care, far more likely to have better outcomes, less likely to die. Exactly. The same thing for like primary care, providers. And again, all out of the United States, but race concordance really does help to have better outcomes. And so that is a big thinking behind doing things like the Black application stream and helping to bring more Black people into medicine so that we can, again, improve those outcomes for people in our own community.
No, I agree. There's so many questions I want to ask, but let's move on. So for someone who's been diagnosed with fibroids or PCOS, what should their next steps be?
Yeah, so I think it really depends on how much it is impacting their life and how severe the condition is, right? If it is something like PCOS, we know that is like a chronic condition that has a variety of different impacts for the person. So increases their risk of like not only type 2 diabetes and like hypertension, but also depression later on in life. So making sure they have good primary care for those things. And then looking after like the uterine health side of things. So we know that they're at increased risk of uterine cancers, for example, and that, someone should be monitoring to make sure that they're not having completely irregular periods to the point where like some people only have 1 to 2 periods a year.
I have some friends like
and that's not good. That's not healthy. That's not normal. If we're not trying to actively suppress your period and you're only having 1 to 2 periods a year, you need at least 4 minimum per year, because that increases your risk of endometrial cancer. Right? And so we need to make sure that Black women, all women who have these conditions are connected to someone who is in primary care who's able to at least do some of the monitoring for these things. Again, some of that is outside of the scope of what primary care, is providing. And so they might need referral again to a gynecologist for management of some of those things. But I think ensuring that they're connected with good healthcare providers who are able to follow, again, there's so many guidelines in these different conditions and like what is the best practice, but making sure someone's looking out for them. And again, those risk factors of like down the road of depression, diabetes, like all of those conditions are all possible with PCOS. And we just need someone who's looking out for these women.
Yeah, that makes sense.
Are there any lifestyle changes like diet or stress management or exercise that can help manage symptoms or prevent conditions like fibroids and endometriosis?
Yeah, that's a great question. So I think if we knew with 100% certainty what caused those conditions to happen in the first place,
Yeah.
we would all be very wealthy
Right.
because wouldn't someone love to have the magic bullet for those things?
Yep.
But certainly to maybe not as much in the prevention realm,
Yeah.
but so much in the like helping with treatment realm of things. PCOS is a big one that can be managed with lifestyle.
Yeah.
Right.
So we know that like healthy diet, regular exercise, if someone is overweight, then decreasing their weight by 5 to 10% of their body mass can actually regulate their cycles in a lot of different people and decrease all of those risks that I was talking about already. And I think just in general, food is medicine. Like what you put into your body, like on a day-to-day actually really adds up and matters. And so while, I don't know the studies exactly for endometriosis and fibroids, but again, I imagine you just taking care of your body and taking care of your wellness and like your spiritual self and all of those things should be helpful as well.
And for myself, I remember I was going to work and I woke up in the middle of the night and I had this huge pain and I was like, what is this pain? I've never had this before. So I'm like, let me just go to work. I can handle this. I go to work. I'm like, I have to go to the ER. So then I go to the ER. They're trying to do like the blood work, all those things. This was in my 20s. And then they ended up doing a CT scan because X-ray wasn't showing anything. And then that's when they said, oh, you actually had a cyst that burst. And that's when I found out I had ovarian cysts. And so as that progression kind of went on in my early 20s, trying to figure out what was working, what was not going to work, and doing my own research, having to see multiple doctors. I probably saw like 5 different doctors. One wouldn't even look at me, one touch me, nothing. She just kind of was like, here's the pill. Just that was her explanation of everything. I went back to my family doctor and I said she didn't want to look at me. She didn't want to talk to me, nothing. And I could already tell that it was more racism on her end of like, why are you worried about this? Just take the pill. So I was really frustrated. But at that time, my family doctor was great. So then they referred me to another doctor. And he was like, okay, let's do our exploratory surgery because this is really the only way we're going to be seeing what's inside, what's going on. If there's other risk factors, maybe you have endometriosis, maybe you have all these things. And so I ended up doing the surgery. They found some cysts, removed those. But as like things progressively got worse, I realized I had to make lifestyle changes. So even though I've always been like smaller in frame, doesn't mean that I'm healthy. Do you know what I mean? And so I had to remove, I saw that like red meat was something that was triggering. So I looked at things that was also inflaming my body that could probably cause them to grow. So for me, for some reason, they grow and burst. And it hasn't stopped even like postpartum, all those things. So it's a little bit frustrating. But so I'm at the point where I like cut out dairy, cut out red meat, and chicken, and now just kind of eat seafood and like have more of that diet and try to do like wellness and practicing like less stress. So it's interesting because I know a lot of Black women kind of feel that isolation because no one at that time was talking about it. But I feel like more people are talking about it now. But in my 20s, even like my family didn't really believe me. They're like, yeah, you're fine. It's just periods, like no one understood it. And then like even family back home, it was just kind of like, you'll be fine, like we
just
have
take a
these,
pill.
like, and I did try having the pill as well. Like I did try going on multiple different ones. They made me absolutely insane. It was crazy. Like I had the opposite reaction of what other women have. Like I was like going paranoid. I would see things. Like it just didn't react well to my body at all. And that's when I was like, let me go the healthy route and let me just go like more lifestyle change. So that was more beneficial for me. But it was a very lonely time because at the time, no one else was understanding what I was going through. I was in so much pain. Like you're bloated, you're frustrated, you're in pain, and like it's not your period time. And so I know that a lot of Black women right now are feeling that, the isolation. I know a lot of women who are maybe immigrants to this country as well, trying to navigate the system. And we know after 2020, the healthcare system has changed as well. And so how do they kind of manage, and you might not even know this answer, to be honest, maybe it's like a conversation piece, but like, how do you manage that loneliness, that isolation, in the space, where you feel like maybe you're the only one going through this, but as maybe we see more on social media now, and maybe it's more like Black America as well who are speaking up. I don't feel like maybe we're not having enough conversations in Canada about it. So maybe the isolation is that too. I'm not sure. But yeah, how do we maybe even tackle that loneliness? I know this platform as well, we want to highlight more. And we did the Uterine workshop last year that was virtual, and we want to continue having more conversations. But I'm not sure, like how does someone kind of help themselves in that isolation where you kind of feel alone?
Yeah, it's really hard because I think a lot of reproductive health topics are a bit of taboo.
Yes.
Like aside from like having a term healthy pregnancy,
Right.
everything else is like, oh, don't talk about that.
Yeah,
Oh, you
yeah.
had a miscarriage. Like, oh, don't talk about that. You know, like, oh, you had cysts that are so painful that you're in and out of the hospital.
Right.
Like
A lot of the times, even just periods.
Yes.
yeah,
Periods all.
yeah,
Right?
like tampons.
Whisper.
Oh my
Yeah.
gosh.
Yeah.
Like, oh, yeah. Which is like our own cultural
Yes.
thing that I think needs to be addressed over time. But I think like spaces like these and having Black Women Connect Vancouver and like other spaces that are like this where Black women can share their stories and like in a safe space of other Black women who may also share very similar experiences
Yeah.
is incredibly helpful. We know in terms of like, again, just to bring it back to like data science stuff, in the US, like interventions at like barbershops and beauty salons have like all been shown to be like enormously substantial for communities because it's a trusted space, you know, like you trust the people that you're in these spaces with.
Yeah.
These people look like you. They've had similar life experiences to you. And I think, you know, that's the same thing with groups like this.
Yeah.
And that's really important to bring it
Community,
exactly, bring it back to the community.
Yeah.
And I would urge people, like, again, it's obviously it's up to you. It's your health to be able to share. So thank you for sharing your story. Help people feel less alone who are going through that. But, you know, I would urge people, like, again, within these small, safe, you know, Black-led communities, like, we can be a community for each other.
Yeah, no, exactly.
Yeah.
Continuing talking about prevention, what are some things Black women can do to support their uterine health, even if they don't have a diagnosis? What would you suggest?
Yeah, I think it's the usual, like, you know, consume a good diet, like exercise. Like we all know exercise is good for us. Like I don't exercise.
Yeah.
Like
Do my little stretch in the morning.
like yoga.
Right?
Yeah. Eat healthy foods, like put good foods into your body, like try to sleep for a good restful amount per night. You know, for you, that might not be 8 hours, but like maybe 7 hours is fine, you know, good enough for you, for example. Trying to decrease stress in your life.
I was gonna say, I'm like, we carry stress. We really carry stress,
especially in
our bodies.
Right?
Yeah. Whether it be like our work environments, for example, right? If it's a stressful work environment, I feel like that triggers a lot.
And just like, again, so many of the studies of like Black women and like hypertensive risks and like hypertensive disorders of pregnancy risks and things like that are like, it's because of toxic stress. Because like, again, in America, because we don't have the studies in Canada, but Black women in America are under like toxic levels of stress. And this like eats away at a cellular level at them. And so puts them at higher risk for these different conditions. And so I think like, taking over that and being, you know, obviously we're working in a systemically racist system, but trying to take hold of that and like decrease our stress levels to be as healthy as we can is like, that would be the ideal.
Yes.
Way easier said than done, but yeah.
Well, thank you so much for coming. I know this is a short conversation. We could talk about this topic for a very long time. I'm sure if we had like an open chat, there'd be so many questions coming in, but we do want to continue having this conversation, obviously, and it won't be the last time, but we really appreciate taking the time to have this conversation with us. I know you're busy with residency, that we really do appreciate it because it's something that we want to make sure that we start highlighting and not ignore the fact that we know that Black women are struggling with this and advocating for themselves. And so, thank you for sharing your knowledge and just being in the space with us.
If folks want to connect with you or follow your work, is there somewhere they can do that?
Yeah. So I'm not on like social media tons right now. I used to be on X, but I have not been on that for a while. So I would say like the campaigns that I'm part of, if people want to follow along with that, like I was a part of the Access BC campaign, which was part of bringing like free prescription contraception to the province.
Right. Okay.
So you can follow us on our, like we have social media handles, like just look up Access BC and you'll find our website. And then Black Physicians of BC is the other big group that I'm part of. Founding board member for that. So again, we have social media, we have a website. You won't, again, like you don't directly interact with me on those, but if you want to look at some of the work that
You're doing.
That you do.
yeah. And I just also wanted to put up, like, thank you for creating this space. I think, you know, we have historically like suffered in silence.
Yes.
And I think that like as Black women, we're always told to be like, be strong, like like it's fine, push through, like go to work. You're fine.
I know. Even in my mind, it was just a normal reaction, right? Yeah. Don't go to the hospital.
But like, it's real. Like these conditions are real and they're hard. And, you know, we all deserve to have a doctor who will explain, you know, the condition to us, who will give us like resources on how to read more about this condition. And sure, if the treatment is not, you know, if the person wants to suggest like the oral contraceptive pill, like giving some reasoning
as to why.
Yeah. Like that's, you know, that's what when I talk about cysts and I prescribe oral contraceptive pills, I say, this is, you know, the mechanism of what's happening. This is how we're targeting it.
Right.
Yeah. And again, if that doesn't work for you,
what's the next thing?
Yeah. What's the next thing that's going to work?
Yeah.
Yeah.
So, and I think sometimes even, when you're a teenager as well, because a lot of some of the period issues, you know, start from when you first have a period, and then it's like kind of that, you know, 15, 16 age, you know, when you start finally knowing your body and understanding it. And I think a lot of the Black girls as well are starting to struggle with that as, and so it'll be good to start having conversations also for what does that look like for teens. And so preventing that, so when they go into their 20s and 30s,
they know what to do.
They understand, you know?
Yeah.
It's like we may not have had that, but if we can kind of teach the next generation, then they don't have to go through what we're going through, because they're already doing preventative measures to make sure that they understand what's going on in their bodies. So I mean, that's a different podcast episode. But thank you again so much for having us. And to our listeners, if this conversation resonates with you, share this episode with a friend. Let's keep this conversation going. And you deserve to be heard. You deserve quality healthcare. And you're not alone in this journey. We've shared different counselors' stories. And so we just want to make sure that we wanted to highlight that this is an issue that a lot of us deal with. And Canada needs to do better with the statistics. We've talked about this on so many episodes. There's no stats on anything for Black women in Canada. And I will always say this. And so thank you so much for joining us on this episode.
We'll be continuing this conversation in person in our Black Women Vancouver, Connect Vancouver Uterine Health Workshop conversations. So be sure to follow us on social media, Black Women Connect Vancouver on Instagram for updates. Yeah. And again, thank you so much for being here, Dr. Ruth. We really appreciate you.
Likewise.
Bye, everyone.
Bye.
Bye.
Thank you for listening to our podcast episode. You can find us in all streaming platforms, and you can watch our video recording up on YouTube channel, Black Women Connect Vancouver. Until next time.